Oh my god, no! No, no, no! No! No!
You're probably wondering what exactly just happened. How can one suffer cardiac complications from watching a hockey game? Let me tell you about Takotsubo cardiomyopathy. You may have heard of it as broken heart syndrome, and it's when the heart muscle becomes suddenly stunned or weakened following some emotional or physical stress. Common triggers can include the death of a loved one, a serious accident, a fierce argument, or a sudden illness, or such as witnessing the loss of your favorite hockey team. In this condition, the left ventricle changes shape, affecting the heart's ability to pump blood effectively and efficiently. The main symptoms that this dedicated fan just exhibited are sudden chest pain, shortness of breath, and fainting, which are similar to those of a heart attack and usually caused after feeling severe stress. If you ever feel any of these symptoms, call 911 immediately or visit your local emergency department. This acute stress to the heart generally occurs over a short, well-defined period of time. Individuals over the age of 50 have an increased risk in developing Takotsubo syndrome, and it's found that 90% of patients with Takotsubo are women. Additionally, those who have psychological disorders have an increased susceptibility in developing Takotsubo syndrome. And a fun fact is that the heart's chamber looks like a Takotsubo pot, which is a Japanese fishing pot used to catch octopus and is what the disease is named after.
Where am I? What happened? Why am I in a hospital? What's going on?
Hello.
Hi.
So, you've had an episode of Takotsubo syndrome from the emotional stress of the hockey game.
I had what?
Takotsubo syndrome. We did some tests to make sure that it wasn't a heart attack and determine the cause of your symptoms. We're able to confirm that it was Takotsubo syndrome. The tests that we did were an EKG to look at your heart's electrical activity. We did some blood tests to look at the levels of enzymes from your blood, because when your heart gets damaged, certain enzymes are released into the bloodstream, and we can detect those and determine if it's a heart attack or not. We also did echocardiogram, which is an ultrasound of your heart that detects the movement of your chambers and the blood flow in there. And then the last one is a coronary angiogram, which ensures that the appropriate blood flow is going through the arteries. And the main difference between Takotsubo syndrome and a heart attack is that in a heart attack there is a blockage, whereas in Takotsubo there is not, and you in fact did not have one.
Okay, so it was the shock of the game that induced
Yeah,
this.
you're just a dedicated fan. Now let me tell you a little bit more about Takotsubo syndrome and how it affects your heart specifically.
Okay.
When we experience a stressor or strong emotional stimuli, catecholamines such as epinephrine and norepinephrine are released in our blood. In some cases, the sudden release of these hormones in high volumes stuns the heart and results in cardiac shock. The hormones act directly on the beta-1 and beta-2 adrenergic receptors in the heart. Typically in small doses, catecholamines result in an increase in contractility of the heart, but if the heart is consistently stimulated over a long period of time, the receptors can change the effects they have on the heart's contractility. Beta-1 adrenergic receptors are activated by norepinephrine and are stimulated to increase contractility and maintain function even when overstimulated. On the other hand, beta-2 adrenergic receptors are activated by epinephrine and initially result in an increase in contractility. When the beta-2 receptors are overstimulated, they begin to decrease contractility. There are high concentrations of beta-2 receptors located at the apex of the heart. When these receptors are overstimulated, it results in akinesis at the apex of the heart, leading to a reduction in contractility in the apex towards the left ventricle. This reduction in contractility is what prevents the blood from being effectively pumped out of the heart, eventually leading to more detrimental symptoms mentioned earlier.
So, are there any treatments for this?
Yeah, so there's a couple of heart failure medications that you can take. So you can take ACE inhibitors, beta blockers, or diuretics, and it'll all help your heart get back to normal.
And how long is approximately recovery from it?
Yeah, so your heart muscle will go back to normal and fully recover in about 2 to 4 weeks. And then full recovery from Takotsubo syndrome takes about 2 months. There might be some long-term complications, such that you might experience shortness of breath or being unable to do high-impact activities.
Okay.
Takotsubo syndrome from overwhelmingly exciting situations. They don't necessarily have to be sad. Generally, you should be okay though, as long as you're taking care of yourself in all aspects of wellness.
Okay, thanks, Doc.